Welcome to ThinkTech Hawaii Business Education Spotlight. My name is Alice Li Hagan. This is our bi-weekly conversation with interesting people, entrepreneurs, and fascinating leaders in the community who contribute to the social, economic well-being of our state. Today, my guest is Dr. Timothy Duerler. He is from the Big Island, president of Mango Medical, which was actually identified as one of the fastest 50 companies in Pacific Business News for this year. Dr. Duerler is joining us on Skype, and welcome, Dr. Duerler.
Thank you.
Wonderful to have you with us today, and I'm so glad that our technology is working for our Skype interview today.
Yes, sorry I couldn't be there in person.
Well, perhaps next time, but it is really good to have you with us. I know as I think about how I get connected with you, I saw this newspaper article in the Pacific Business News probably 4 weeks ago about your medical practice on the Big Island. And I think what drew me to that article was the name of your practice and the fact that I guess the journalist said that it's a way to address the doctor shortage here. So I think for the next 45 minutes, we will have a lot of interesting topics to cover. But first of all, Tim, tell us a little bit about yourself. I know your specialty is in family practice. You did your residency here at JAPSOM, the John A. Burns School of Medicine at the University of Hawaii. Tell us something more about yourself, please.
Sure. So I'm like you mentioned, a family practitioner on the Big Island now. And my first real connection with Hawaii was after I did finish medical school, and I came out for a 3-year postgraduate residency with the University of Hawaii. What really drew my interest in coming to Hawaii was kind of the mix of kind of being in, kind of the islands and kind of the needs that were there and some unique opportunities. And really some of piqued my interest was some of the tropical diseases and things, some different things that we can see here in Hawaii that I have an interest in, infectious diseases that we didn't see on the mainland. And after doing 3 years, I was hooked on Hawaii and knew that this was home for me and my family. And they sent us out to the neighbor islands, to the Big Island, which I didn't have much knowledge of before going out. I worked in the Hilo Medical Center emergency room and some private clinics, and I just fell in love with kind of the pace and feel of the neighbor islands, and everybody shared what great needs there were for primary care and medical care. So as soon as I finished up, actually before I finished up residency, we started our first practice in Hilo, and did that for a couple of years, and then 4 years ago we started Mango Medical, which is currently what we're.
Now, there are a lot of questions that I asked just from that very quick introduction from you. You said that when you first came here for your residency, you see a lot of opportunities. Now, first of all, can you remind me again and the audience, where on the U.S. mainland did you come from?
So I'm originally from the Midwest, so Ohio. I went to University of Cincinnati Medical School, and had done, spent most of my kind of training and school years there, and so graduated from University of Cincinnati Medical School. From there, headed out to Oahu for 3 years of the program.
So when you had to decide where to go for your residency, was the University of Hawaii your top choice, or were there other places that you were considering?
So definitely it was my top choice, and to be honest, from what I learned about it, I didn't expect to be able to come here, because a big part of University of Hawaii's program is to provide doctors for Hawaii. So obviously they look for people that have some sort of, that are from the islands or have some connection to it. And here I was a guy from Ohio that didn't have much connection to Hawaii, so I was pretty excited that, and how the residency match works is almost like a lottery system. And so you pick, so as a physician, kind of just getting out, we rank where we would like to go, and then the residency program ranks their candidates, and then it feeds into this big computer system, and then there's this day called match day where they announce where you go.
Right.
And it's a big deal because most residents or most physicians end up practicing where they do residency. So.
Yeah, and I recall reading articles written about these residency days, and as you said, it's a big deal. But now you came here, you said you've worked at UH Hilo at the emergency room. So when you were first, I guess, assigned that opportunity, what were some of the things that struck you compared to what you were doing in Cincinnati? Can you share that with us?
Sure. And first impression was, it's a very busy, I'm not sure if it still is, but for a while, Hilo Medical Center Emergency was the busiest ER, even busier than Queens and Honolulu.
I didn't know that.
Yeah, so I don't know if it still is, but it's very, very busy there. And so you see all sorts of things coming in, traumas, and one of the big things that struck me and all the ER docs that worked there was just their frustration is that people repeatedly coming in because they didn't have a primary care doctor. And so they were essentially using the emergency room for their primary care, or waiting until they were really sick, coming in with massive heart attacks or strokes, things that could have been prevented if they had a primary care doctor. So that was something that struck me right away, was just how big the needs were on Big Island. So it was, and then the other thing that I saw was some really interesting things, some things that you don't think about anymore, but I remember finding an undiagnosed case of Hansen's disease or leprosy, and other kind of infectious diseases that we don't think of, or basically are almost unheard of on the mainland, that are still in small numbers here.
Now, so this was your experience here, and let's jump forward and talk about this medical practice you have, the Mango Medical. How did that idea come about? I mean, you were alluding to this whole issue with the emergency room, and patients were using this primarily as not for emergency, but because of a lack of primary providers. So was that kind of something you saw, and that kind of planted the seed to think of a business model that would work?
Yeah, so I saw the need was there, and I talked with a lot of the doctors in the Hilo community that had been there a long time. And basically they were very supportive in terms of, if you come and you kind of, but they weren't ready to, grow and expand and add on these providers and things like that. So you basically still had to basically start the practice from scratch. And so there wasn't many opportunities just for employed physicians. And so I kind of took that, and I knew I wanted to practice there, and I went ahead and learned as much as I could about, running a practice and starting a practice and things like that. And launched it, and then both my wife and I, we spent a lot of time looking at different types of practice models and really trying to find something that was, I would say, sustainable, both from the provider side. There's a lot of talk, especially in the medical world, about physician burnout,
Right.
just because of the need and the hours and the demands and things like that. And being able to survive in private practice and all the demands that from medical and the practice management side. So we looked at a lot of different models and came on the model that we chose for Mango Medical. And I speak about my wife, she's a nurse practitioner. So we started it together.
Okay. Could you tell us a little bit about, I'm not sure whether I should ask you to tell us a little bit about the business model of Mango Medical first, or perhaps to give us an idea of some of the challenges on the Big Island. Now, you alluded to private practice, maybe physicians are not ready to grow and there are issues with burnout. So, share with us some of your insight.
Well, one of the big things, that attributing to, physician, burnout and things like that, is just the volume, and I think physicians, over time getting frustrated with some of the models and the way, traditional practices are going, where it's higher volume, you spend less time with the patient, and you're expected to see, 30 patients a day, 5 to 10 minute slots for really complex problems in primary care, and it's just not sustainable long term. And so that's, one of the things that we saw, and we looked for a different model. And there's multiple things that we took from different things, but I think some of the technologic advances in terms of, electronic health records and some of those things, if you use it, it can slow you down, but if you use it efficiently and kind of understand it, it can really help, and that's one of the things that's helped us cut down some of the expenses and some of the overhead costs. Really, the goal is to allow us to spend more time with patients and not have to see that high volume of patients. And it's a win-win for everybody. And the physicians enjoy it more because you get to spend more time with good care, and you're not, spending all your time doing documentation and things like that. Patients enjoy it because we stay on time. You're not keeping the patients waiting. They're seen at their appointment time. We have 30 and 60-minute times with patients.
Wow.
Which is unheard of now.
Oh, that is amazing. Now, Tim, we're coming up on our first break. You talked about technology. You talked about working very closely with your wife, who is, I'm sorry,
Nurse practitioner.
A nurse practitioner. So after the break, I'd like to go further or drill down into, okay, how do you partner with nurse practitioner, and how is it different from, I guess, the care model that we are more familiar with?
Okay.
Great. My guest today is Dr. Timothy Duerler. He is a physician, a family physician, and he has a clinic at Mango Medical on the his company, or his clinic, is also identified by PBN as one of the top 50 fastest growing companies this year. You're watching ThinkTech Hawaii Business Education Spotlight. We'll be right back.
Aloha, my name is Miley Scarpino, and I'm the host of the Empower Hour. If you're interested in health, nutrition, fitness, here on the island of Oahu, want to learn more about places to train at or different trainers available, then watch my show on Fridays at 3. We have a great time, and I hope that you'll come join us. Much aloha. Now go get swole.
Aloha, my name is Josh Green. I'm a senator from the Big Island. I work in the ER there. But on Tuesday afternoons, I get to come and spend 45 minutes to an hour with Jay Fidel and the ThinkTech staff. They're terrific professionals. They help us to bring some of the leading cutting-edge topics here across our state to you. So you can join us at our show on healthcare in Hawaii to talk with leaders from across all the spectrum of health in our state, or you can join us for any other show where we talk about economic development or tourism or some really eclectic programs too. So really, we love to see you here on our show. Thanks for joining us, and thanks for supporting us.
Welcome back to ThinkTech Hawaii Business Education Spotlight. If you are just joining us, my guest today is Dr. Timothy Duerler. He is the president of Mango Medical from the Big Island. So Tim, you were talking about technology and how the use of electronic health record actually helps you gain more time to allow you to spend more time with your patient. Tell me how when did you start this practice of yours?
So we started Mango Medical in, I believe, October of 2011. So we're coming up on 4-year anniversary pretty soon.
Okay.
And we started out in Waimea on the Big Island. It was just my wife and I that started. And we added another part-time physician, but really for the first 2 years, it was just us. And it was really kind of the exploratory period to see if, kind of our model would work. And after 2 years or so, I was really pretty well convinced that it was working well. And one of the things I wanted to do was look at expanding that. And again, going back to being able to offer, I had so many friends, physicians, and things like that ended up leaving the islands, leaving the Big Island, not because they didn't want to practice there, but they just didn't feel like they had the support or the structure or the organization. Yeah. So I got the idea of offering, basically expanding what we already started and offering to other physicians, and then also utilizing nurse practitioners and physician assistants in our model to kind of grow that. And really done over the last year and a half has been our really, growth from 1 clinic to 6 clinics with
6 clinics, wow.
14 primary care providers now, doctors and nurse practitioners and PAs.
How many doctors do you have right now then? Oh, and nurse practitioners?
So we have 4 physicians, and we're actively looking, for we'd like to have in each location, and then we have 5 or 6 nurse practitioners and 2 PAs. The primary care piece.
Oh, okay.
And one of our goals is to work closely together. We kind of like a core unit or clinic kind of setting is to have a physician that works closely with a nurse practitioner or 2 nurse practitioners. So it's kind of.
So how does that work then, Tim? Because I guess when I have a medical appointment, I know that there are nurses who kind of check me out first, and then the physician would come in and address all the issues. So how different is this from, say, the model that you're using to work so closely with the nurse practitioner?
Yeah, well, there's a lot of, I think education and understanding what the different levels of nursing training are. And so there's a lot of different terms. There's certified nursing assistants and licensed practical nurses and registered nurses and advanced practice nurses. And so all of these, and there's a lot of difference in training there. And so what a nurse practitioner is, for anybody that doesn't know, they usually have their RN first, registered nurse, which is a 4-year college degree. They go on basically a master's level degree, but it's clinically oriented. And so at what's called APRNs, or Advanced Practice Registered Nurses, they're licensed. They basically, for primary care, have their own panel of patients, see their own patients, can prescribe most medications, the ones we work with are excellent. I think the nursing training, the nursing background, they're very focused on education, and a lot of times do a better job than I think the physicians in kind of spending time and kind of educating about certain conditions and medications and things. So how they work with Mango Medical is patients will have, the nurse practitioners will have their own panel of patients. that, the physician, may rarely see, or, just available if there's a question or things like that. But then we share. So, if you're sick and you've got a sore throat and a cold, my schedule's full. Most people would prefer to be seen right away, and we can offer that right away. So it's available. So we share and collaborate. And it works well because one of the things is, we want to be able to see people right away and kind of that level of convenience. So that's how we work closely with industry.
I see. So are there similar practice to yours, either on the Big Island, other islands, or here in Oahu?
I'm sorry, what was that?
Oh, are there other practice that use a similar model of physicians working closely with nurse practitioners on the other islands or even here in Oahu?
Yeah, I think there is. I think, I practiced a little bit of time in Seattle, Washington, and, I think Hawaii is still learning how to utilize nurse practitioners and also physician assistants, which is another, kind of training that, can do a lot of similar things. And I think it's a real, I think there needs to be more education and knowledge about it, but yeah, they are utilized. I know, the hospitals utilize nurse practitioners, Kaiser, for example, bigger system does. But I think that, especially with the shortage of providers that we have and the healthcare needs in Hawaii, I think we could do a lot more to promote and utilize nurse practitioners.
You just made me realize a couple of weeks ago I had a conversation with the School of Nursing with their dean, and they're actually developing a doctorate of nursing practitioner, which will be launched next year. So I guess I just put that together. So hopefully they will have a pipeline of nurse practitioners who could help clinics or clinics like yours or other healthcare facilities across the state.
Right. And the DNP program is basically like a little bit more training or education above that, that master's level.
Now, let's talk about some of I guess you said you have 4 physicians, so I presume you're counting yourself then, right?
Yes.
Okay. So with the other 3 physicians, how did they decide to work for you, and what's some of the feedback that they've given you about this particular business model that you have?
So, hopefully I'm not over speaking for them, but, one of the big things that we look for, especially the Big Island, it's, a little bit further distance, a little bit more rural community, so small town community. What's worked the best is someone that's kind of already connected to that community or similar communities. So the other physicians, say down in Ka'u district, Na'alehu is very, probably most rural area. But she had already had a connection down there, and the community wanted to be in the community, so was very happy to work with us. And I think we offer a lot of flexibility, which is good. Physicians, have a life like everybody else, and you have kids and responsibilities for that and things like that. So I think we respect that and kind of allow flexibility in terms of scheduling and things like that that I think the physicians appreciate. And we also support what their interests are, like special interests. So, for example, my interest is, in addition to family medicine, is HIV and AIDS work and things like that. So I do a lot of kind of work tailored around that. Some of the other physicians have different interests. Dr. Dano, who's down in our Ocean View office, she's a osteopathic physician. So
I'm sorry, what does that mean, osteopathic?
So there's, again, like the nurse practitioner, there's 2 different kind of training programs for physicians. So my degree is a medical doctor or MD, similar to like what you can get from University of Hawaii Japson. But there is osteopathic medical schools, and then you have a DO as the title, and they're spread out different places. There's a program now on Oahu training for DOs connected with Waianae Comprehensive on the Beaver side. But for all intents and purposes, when you get out, you know, there's a little bit different training, but a lot of it's similar, and you can do a lot of the same, basically the same, you know, kind of licensing and ability to do, you know, and MDs or DOs do primary care, they do surgery, they do specialty. But the one thing that is different, the DOs, they learn something called osteopathic manipulation, which is a technique that, you know, I did not learn in school and training. Some people equate it is different than chiropractic, but it's kind of more physical body work.
Oh, okay, interesting.
There's not too many that do that anymore. But it's one of two physicians that I know, at least on the Big Island, if not in the state, that still do that. So, yeah, so we, you know, she had an interest in doing that and wasn't able to really develop that in other places that she had worked. So, so we support that, and she incorporates that into her practice.
That's great. Now, you said you have 6 clinics, so I presume, and then you mentioned about flying to Maui once in a while. So where are all your clinics then?
So we have 4 locations on the Big Island and 2 on Maui. And so we say we cover the 4 corners of the Big Island. We have Hilo, Kona, Waimea, and Ocean View, which is down in Ka'u, District, South Point. And then Maui, we are in Wailuku, and then Makawao.
Okay, so so I know you fly to Maui once in a while, or regularly. So do the other physicians do the same thing?
No, I'm the only one that gets to travel extensively. Most of the other physicians are, you know, again, you know, connected with that community.
I see.
Part of the reason I started going over to Maui was, I mentioned earlier, my interest in HIV and AIDS. And a couple of years ago, 2 years ago, when I started going over to Maui, it was really at a request of the AIDS service organization over there, because there was not too many providers. They had either left or were getting ready to retire or retired, so there wasn't too many people doing that. So that's how I started going over to Maui, and then I saw the needs for primary care on Maui, just like there are on the Big Island. So we were looking at developing, really probably focusing more on Maui and developing the clinics, primary care clinics over there.
Okay. Tim, we are coming on our second and final break, but when I come back, I'd like to talk to you, or I'd like to ask you to switch hat to talk about you as an entrepreneur, because at the end, this is an entrepreneurial venture. And where do you see your business, you know, 5 years from now?
Okay.
Great. My guest today is Dr. Timothy Duerler from Mango Medical. You are watching ThinkTech Hawaii Business Education Spotlight. We'll be right back after the break.
Aloha, I'm Carlos Juarez, host of Global Connections, and I want to invite you to come join us. We cover a range of global issues. We bring a lot of expert opinion, a lot of issues, whether they're contemporary events happening in the world or maybe looking at things from a more historical perspective. Global issues, very important for us to understand in this globally interconnected world. Join us here on Global Connections.
Aloha, I'm Kirsten Baumgart-Turner, and I host Sustainable Hawaii every Tuesday from 11 a.m. to 12 noon. My guests offer insights on challenging economic and environmental issues facing our state and offer innovative solutions to increasing Hawaii's long-term sustainability. Recently, we've been focusing on sustainable land development, food, and energy security. If you have a project or issue you'd like to discuss on the show or would like to be a guest, please contact me at kirstenbturner@gmail.com and tune in live weekly or view the show at your convenience at thinktechhawaii.com. Mahalo.
Welcome back to ThinkTech Hawaii Business Education Spotlight. Today my guest is the president of Mango Medical, which has been identified by the Pacific Business News as one of the fastest 50th growing company here in Hawaii for this year. So Tim, before the break, we talked about the physicians, the model that you have working closely with nurse practitioners. You travel between the Big Island and Maui. You've got 6 clinics, and you grow your business really, really quickly in a matter of a couple of years. So now let's talk to you as an entrepreneur. Was this part of, I guess, your thoughts when you get into medical school that you will also become an entrepreneur?
I don't think, when I went into medical school, I didn't, this wasn't a plan that I was going to go and start these clinics and things like that.
Mm-hmm.
I think, as I got into medical school, I enjoyed the idea of creating something new and kind of being able to adapt and kind of utilize new technologies as they come out and things like that for better patient care
Mm-hmm.
and their models.
Mm-hmm.
So, I think once I got to residency, I think some of the other, physicians thought I was a little crazy because I started, actually, as I was a resident where we worked 80 to 90 hours a week, in the last few months of that, I was flying back and forth to Big Island, and I actually started first practice while I was still a resident.
Oh, uh-huh.
So I finished my residency on Friday, and I started in our new clinic in Hilo on the Monday after that. So pretty much from there, from residency on, I knew that I enjoyed doing that, and that practice is still going.
Uh-huh.
Hilo, even though I'm not affiliated with that.
Oh, really? My gosh. So
This is the second medical practice that I started. But Mango Medical, I think there's a lot of opportunities. You look around the communities, both on the neighbor islands. I think there's plenty of more opportunities where we're currently at. And I think there's, I'm not opposed to looking at, Oahu. I think there's still potentially some needs there. And again, like I said, I think it's what we've created is really a kind of a winning model, both for patients. I think the feedback that we get, are really positive patient experience, and then also for the providers.
that must be fantastic, but I also have to ask you about being an entrepreneur, because recently I was at a conference where they talk about how Hawaii should foster more entrepreneurial spirits. They talk about technology, they talk about startup. I know you use a lot of technology in your business, but to make that leap to really start your business, and there were people who talk about that, the willingness to take risk and not fearful of failure. So how did you make that leap? Because you could have been just a physician and perhaps work for a big facility, but you decided against it.
Yeah, and I guess it comes back to you look at what your vision is for how to practice and things like that, and if there's not an existing model that supports that, or in the location that you want to be, if you're willing to take that risk, you can do it. I guess I have the temperament to do that.
Mm-hmm.
They certainly don't provide any training for that. Presence, trying to help with that with the current medical school, trying to show that there is opportunities for that. But it's really, it comes back to a passion, or, if it's an interest, you're willing to put your heart and soul into it.
Right, right. Now, in the next couple of years, well, I guess I looked at the numbers quickly because you're one of the fastest 50 companies, and actually they said that you're ranking, Mango Medical ranked number 13 out of these 50 companies, and you've grown by about 165% in 2 years. So how do you see Mango Medical going, forward in the next couple of years?
I think there's a lot of opportunity. To be honest, I think the hard work, a lot of the hard work, going from, I think it was a big leap going from, one practice that basically I was at to kind of these multiple locations where, I'm not at on a regular basis. There's other physicians that we, that take charge and really kind of, develop the clinic and provide the support. So, so I think we're at the very beginning of an exciting time, and I think that we're just starting on what we can do in terms of expansion and really growth potential. And we're seeing, this year is going to be significantly bigger growth than what they looked at for the PBN thing last year. So.
Right. That's really exciting. But producer, may I ask you to perhaps show Tim's picture instead? Now, Tim, I know you use a lot of technology. How do you think with all these technology that we have, how is that going to help you with your practice?
Well, we one of the things that really helped us grow and do these multiple locations is the current electronic medical record, some of the advances in there. So we have a cloud-based system, so we're not tied to servers and all these things, physical servers in each location.
Oh, okay.
So and I've become a pretty big proponent of the Mac side of things. So it's a Mac-based practice, and we utilize iPads, in the patient interactions and things like that. And it's, that's one of the things that's really helped us, kind of to grow and set up other locations and practices. It's the IT costs and the infrastructure costs are a lot lower. And I think, with that, it allows, good patient care, and there's a lot of things you can do with an iPad, which are really fun. With patients, you can show them, labs, you can show them, images, you can pull up x-rays and things like that, and be really more interactive with the patient rather than just staring at a computer screen.
Right.
So.
Wow. Now, let's talk a little bit about your interest in HIV, because before, I know you went to Maui initially because of that, but you, before the interview, you mentioned that you have a foundation. Can you tell us about that?
Sure. So going back a little bit, kind of what colored my interest in going into medicine was a family friend of mine that was a physician, kind of a mentor growing up, my family doctor. And he had gone over and volunteered and worked in Africa. And before I went to medical school, he took me over to a tiny little country in sub-Saharan Africa called Swaziland, connected to South Africa. It has really hit the hardest by the HIV and AIDS epidemic, highest prevalence of any country in the world. Officially, it's 29%. Everybody on the ground pretty much agrees it's probably around 50% in the entire population. So 10 plus years ago, I went, I saw kind kind of the needs before I started medical school. And that colored my perception going through medical school and kind of my interests in primary care and also HIV work. So when we started Mango Medical, I was actually, briefly, I had relocated to Seattle, and I was looking at either coming back to Hawaii, or someone had presented a position to run be the medical director for an HIV clinic in Africa. And I was half seriously considering it. But family issue, various reasons we decided to move back to Hawaii. But when we set up Mango Medical, we said from the very beginning we wanted a portion of the proceeds from the clinics to go to support some of these greater needs in Africa. And so we started doing that. Some of the patients and friends and family got word that we were doing this, and they wanted to be able to donate too. So it kind of evolved and said, well, why don't we set up a foundation? And since it originally was started from Mango Medical, Foundation. So it's a fully functioning nonprofit that supports the work group.
And you go to Swaziland once a year?
I try to go once a year. We've taken different people to go. Our main focus is there's an orphanage there that kids are raised. They're not all HIV positive, but a lot of their parents died from HIV and AIDS. So we do some, a lot of there's different sponsors and donors that support some of the basic needs of the kids, but we're looking at supporting advanced education, so like scholarship programs, and then there's close to that there's a brand new HIV clinic which was started by a doctor in Swaziland that even though he's 89, it's Dr. Hine, he's 89 years old. His father started the first hospital over there. He's the minister of health. I think he has some entrepreneurial ideas even at 89 years old, and really have this really interesting model to develop this HIV primary care clinic in Swaziland. So we help support that a little bit voluntarily. And then I go over and work there some too.
So do you go with Amy? Does your wife go along with you then?
She's gone, not every time, and she's gone. And we've got a friend of ours that's also basically took the lead as the president of the foundation, is really developing that. Last year I took her and she came along to see firsthand what the needs are and things like that. And in the future, we'd like to take, more groups and maybe there's a lot of things that they would like to see in terms of expansion of the clinics, possibly other, building other clinics in Swaziland. They have this pretty grand vision to cover the whole country with these HIV primary care clinics, and they have one now and they want to build 3 others. So, we'd like to look at helping develop that in the future.
Thank you so much, Tim. It's been great sharing, to be able to hear your story, and I wish you all the best with your practice. I do hope that JAPSOM will ask you to come back and talk to their residents or their students, because it is a success story, and I didn't have a chance to ask you why you picked Mango Mango Medical. I'm sure it's a question that people ask you quite often.
Yes, yeah. So do we have time to answer? Or?
Just a quick answer if you don't mind.
Yeah. So I wanted something that was memorable, that was a little different than other practices. And if you go to our website, we talk about the health benefits of mangoes and prevention and looking, kind of more preventive aspect of living healthy life, healthy lifestyle, healthy nutrition. So that's kind of the short answer. And it's catchy. It's hard for people to forget.
Absolutely. I'm so glad you didn't go to Africa for that position and instead you came here. It's wonderful to have you as one of our doctors here in the state.
Great.
Thank you so much for joining us. I know you had to reschedule some of your schedule, so I'll let you go back to your important work. And thanks again, Dr. Duerler.
Thank you for having me.
All the best. My guest today is Dr. Timothy Duerler, President of Mango Medical from the Big Island. You've been watching ThinkTech Hawaii Business Education Spotlight. Do join us for our next show. Aloha.